Hi everyone. What is congenital cataract? Congenital cataract. Here we will discuss about important facts, its classification, causes in healthy units and in unwell units. Important facts about congenital cataract is that 33% idiopathic may be unilateral or bilateral, 33% inherited, usually bilateral, 33% associated with systematic disease, usually bilateral, and other causes and other ocular anomalies present in 50% population. Classification of congenital cataract: anterior polar, posterior polar, coronary, cortical, spoke-like, lamellar cataract, central purulent cataract, sutural cataract, and focal dot cataract. Anterior polar cataract may be dominant inheritance, may be capsular pyramid with persistent papillary membrane with Peters anomaly. Posterior polar cataract, ocular association, persistent hyaloid remnants, posterior lenticonus, persistent hyperplastic primary vitreous. Posterior polar coronary supranuclear cataract, usually sporadic, round opacity in deep cortex, round nucleus like a crown, as shown in the picture. Cortical spoke-like cataract, mostly it is associated with systematic diseases um, like Fabry disease and monocytosis. Lamellar cataract, usually dominant inheritance, round central shell-like opacity surrounding clear nucleus, may have orders. Systematic association, galactosemia, hypoglycemia, and hypocalcemia. Central purulent cataract, dominant inheritance, spheroidal opacity within the nucleus, relatively clear center, non-progressive. Sutural cataract, usually X-linked inheritance, opacity follows shape of Y switcher as shown in the peak. Focal dot opacity, blue dot, cortical opacity as shown in the peak. Common and innocuous or may coexist with other opacities. Other opacities may also associated with it. Causes of cataract in healthy units: hereditary, usually dominant, idiopathic with ocular anomalies, PHPV, aniridia, absence of iris, partially or completely depend on the case, coloboma, macrophthalmos, ophthalmos. Causes of cataract in unwell units: intrauterine infection, maybe rovella, toxoplasmosis, cytomegalovirus, varicella, metabolic disorder, galactosemia, hypocalcemia, hypoglycemia, Lowy syndrome. Classification: acquired cataract, systematic disease, diabetes mellitus, myotonic dystrophy, atopic dermatitis, neurofibromatosis type 2, ocular diseases, chronic anterior uveitis, high myopia, fundus dystrophies, for example, retinitis pigmentosa, drugs, corticosteroids, chlorpromazine or trauma, a blunt trauma, or it may be short trauma. Congenital cataract, bilateral genetic mutation. Here, given some causes, may be genetic mutation, autosomal dominant, may be metabolic, depend on galactosemia, Lowy syndrome, hypoparathyroidism, and Fabry syndrome. Infective, may be TORS organism, chromosomal, trisomy 21, may be Down syndrome, trisomy 18, Edward syndrome, trisomy 13, Feto syndrome, skeletal Hallerman-Streiff syndrome, Nance Horn or ocular anomalies, aniridia, absent, partial or complete absence of the iris, Anterior segment dysgenesis syndrome are pathetic mostly in 50% population. Congenital cataract, unilateral sporadic, no family history, ocular anomalies, persistent fetal vasculature or cause identified in only 10%. Evaluation of a congenital cataract, the first step is this, screen newborn with a red reflex test, family history, maternal infection, clinical examination, systematic history or syndromes, work up bilateral cases without known hereditary basis, TOD screen, glucose, calcium phosphate, urine reducing substance, amino acid may be Lowy syndrome or Alport syndrome. Congenital cataract, unilateral, sporadic, no family history, ocular anomalies, persistent fetal vasculature, cause identified in only 10%. Um, Evaluation screen newborn with red reflex test, history, family, maternal infection, examination, systematic diseases or syndrome, work up persistent cases without known hereditary basis, start screen, glucose, calcium phosphate, urine reducing substance, galactosemia, it may be Lowy syndrome or it may be Alport syndrome. Ocular examination, formal estimate of vision not possible in neonate, spatial test, preferential looking test, visually evoke potential. Second is density and position of cataract, morphology, associated ocular pathology, indicators of severe visual impairment. Here we see no fixation, nystagmus and strabismus. Treatment, surgery, cataract extraction, and intraocular lens implantation for visually significant cataract by 6 weeks of age, bilateral cases 1 week apart, non-visually significant cases, carefully observation, possible pupillary dilation. Considerations regarding surgery, intraocular lens, power of lens, uh, myopic shift of the growing eye, surgical technique, post-operative intraocular inflammation, uveitis, glaucoma, and retinal detachment may develop. Pseudophakic eye, post-operative consideration, clear vision for distance and near, intraocular lens, regular refraction, spectacles, contact lens, treatment of amblyopia, occlusion therapy. Thank you.